My name is Jacqui Emery. I'm the Chief Executive Officer of Sydney North Health Network. Sydney North Health Network is a primary health network, which is a Commonwealth initiative that was established 10 years ago. And the role of the PHN is to improve the health outcomes for people living in Northern Sydney and in particular priority populations. Sydney North is a relatively affluent area. However, we do have some significant health challenges in the region, and that's really the focus of Sydney North Health Network. So what we do know is that we've got a rapidly ageing population. So in fact, the population is growing 65 and older at an increasing rate beyond the national average. So caring for the elderly is a real focus for the primary health network, and trying to avoid hospitalisations by keeping people as well as they can be in their home. We also know that we have a significantly growing cold population as well, culturally and linguistically diverse population with diverse needs, and so we need to ensure that we can address their needs and make sure that particular diverse community are not falling through the cracks. We also know that we have some significant issues around mental health in the youth, but also we do know that in 2022 we lost 72 people to suicide, and in particular there are concerns with males between the age of 45 and 55. What we know about our priority populations and our most vulnerable people in Northern Sydney is that they're generally dealing with more than one condition. So we know that 37% of people with a mental health issue are also living with a chronic disease, and sometimes that might be more than one chronic disease. And so the kind of care we need to provide to those priority populations needs to be integrated. We don't want those people having to go to a range of different services to meet their needs, because we know that they generally will not. And so there is a lot of evidence around the benefits of integrated models of care, multidisciplinary teams working with priority populations to ensure that they get the care that they need in the right place at the right time. So the neighbourhood health hubs really at their essence ensures that there's a no wrong door policy, and people actually go through the one door to access all of those services. And if not there, that kind of linking up of health providers so that they have a much more seamless experience. And we know right now our health system is very fragmented, and what that means is that those people that need the most support continue to fall through the cracks. And so the neighbourhood health hubs are really designed to ensure that that doesn't happen, and we really can ensure that the people that need us the most will actually get access to what they need when they need it.
Hi, Eugene McGarrell, General Manager for Commissioning at Sydney North Health Network, which means that I work with community to identify needs in the community, what matters to them, and to set up services that better meet the needs of those communities and deliver better outcomes for them. In a recent article that I wrote in LinkedIn, I talked about how Lin Hui, who was a homeless middle-aged woman living in a car by the beach, had no or could see no future. And in the morning there was a knock on the door by May being a peer worker working for a neighbourhood health hub, who helped to navigate her to access health and social care services in a local area. That trajectory meant that she didn't go down a poor health outcome pathway, that she in fact accessed early intervention and was able to stave off illness and chronic disease down the road. It's important to think about the lived experience when we're designing healthcare services for our community. It gives us an opportunity to step in the shoes of people with lived experience, and that in itself is gold. So once we're able to experience from a person's perspective what it's like to be homeless, what it's like to be living in a car by the beach, and what it's like to feel that there is no future, then that helps us think about going to where the person is, also looking at what matters to that person and what do they need to access the services that they need at that time. And one of the things that really resonated for us when we had that story was that what they didn't want was a GP to come and see them straight away. They needed a friendly face that they could trust, a friendly face that they could resonate with, that they could have a rapport with, and somebody that could really help them navigate to a service that they needed at that time, which helped to understand their point of view, understand that they were a mother, understand that they were lonely, and understand that their homelessness was not their fault.
One of the things that we know about Sydney North Region is that we've got world-class hospitals in this area, and so people are relying on our hospital system by default. We know that that's a really expensive end of the health system, and we really want to avoid people being in hospital and staying in hospital.
The health system in Australia really acts like a magnet for the public acute health sector, in that people tend to use local hospitals as their first entry point. They feel that that's probably the first solution for them, either through the emergency department, but they really look at the hospitals as being they gravitate to that as being where their healthcare needs. We worked with communities, and particularly people that have just arrived in Australia. They tend to not understand that they can go and walk into a GP office, access services in the community, and they tend to make as a first line of call the hospital. So that's not the community's fault. It's actually not the fault of anybody working in the health system. It's just that that's how the health system is currently structured. So the challenge for us is to work with those who are currently in the health system and the social care system to really change that way of thinking and change the gravity, so that people see a local neighbourhood health hub as being their first port of call. That really means that the neighbourhood health hub needs to be where people are. It needs to go to the communities that are currently underserved, and that means those communities that are currently experiencing health inequity, which means that their health outcomes are poorer. And those communities include homeless communities, they include Aboriginal communities, culturally and linguistically diverse communities, and LGBTQI communities. So we have to really work with them to understand what are the barriers to accessing healthcare. And what we've learned so far from engaging those communities is that the barriers tend to be that some services are not trauma-informed, which means they don't feel safe for people. Some services are not culturally responsive, which means they're not set up to really adapt to the cultural needs of people, particularly First Nations communities, but not only. And also they present as a government organisation, and people that have left as refugees to Australia tend not to trust government. And so it feels like a government agency, they tend not to go to them.
In order to address their needs, we need to be looking at what is it that they need the most. And it may not just be around their health, it might be around their social networks. Are they lonely? Who are they relying on? How can we connect them to those social supports that they need to keep them well and in their home? So the model of care is a much broader, holistic model, wrapping around the consumers, the patients, their families within these models, and linking them not only within the health hubs but beyond into the broader ecosystem, again to address what they need the most at the time. The neighbourhood health hubs are the core pillar of the 2029 strategic plan for Sydney North Health Network. It really is a bold systems change that requires Sydney North to act as both a steward, a commissioner, allows us to build the capacity not only internally but with all of our providers and partners. I think importantly as well, as part of the Sydney North strategy, is bringing primary care across the region on board with this new model of care so that we're all working together in one system.
Sydney North Health Network fund a number of non-government organisations, providers, who deliver a whole range of primary care services. They include alcohol and other drugs services, they include suicide prevention services, mental health, aged care, care finder type services, and also services to children. So we provide primary care for every age range for people's health and psychological well-being. Those contracts to those providers are currently allocated in a silo way, so each provider delivers a part of the system. What we're moving towards at the moment is bringing those providers together to work as one syndicate and deliver 3 hubs in DY, Hornsby and Ryde, where we know their needs are greater than the rest of the population. And they will form teams of teams in those areas that will be a place for people to access those services, health and social care services. They will also go outreach into where people are. So that might be on the beaches, it might be in the caves up in Brooklyn, it might be in the local streets in Ryde, wherever they happen to be. And we will take the services to them and provide them with access to health and social care as they need it. We're currently working with the providers to design what that looks like and with the community to see what it is they need. Key to all of this are general practitioners and the allied health workforce who are currently in the system and are currently doing a great job working in the system. We would like to work with their lived experience to understand how better to deliver those services so that they're able to deliver the care that they're set up to deliver, but also feel that they've got a team wrapped around them to support them working in this way. We're also keen to make sure that we work with our partners in the local health district to do the same. They hold on to a lot of people who have care needs, and we would like to support them to manage the coordination of care between primary and secondary health care.
We're very much on the precipice of the launch phase of the Neighbourhood Health Hubs. So we have identified where those hubs are. We've identified the primary providers or our syndicate partners that are actually going to deliver those services. And we're looking to start that work from July 1, 2026. Obviously, there's been a lot of building of foundations in order for us to get to this point. And there will still be quite a lot of work to happen beyond July 1 to ensure that we really achieve and realise that vision of that integrated model of care. And so we know that this is a major systems change and that will take time to develop. What we want to ensure is that the model continues to learn from the providers that are working in these multidisciplinary teams, but also from our consumers that are going to use these services so that we continue to improve the outcomes of those priority populations and those that need it most. So really we're looking at a 5-year journey to ensure that this delivers on the full vision, not only within the health hubs, but that broader health ecosystem across Sydney North.